nursing student, and my clinical instructor has assigned me to observe you today.
Excellent. Feel free to ask any questions you might have.
Thank you so much. I look forward to learning a lot. So you're taking care of the patient in room 620. Do you have time to give me a report?
Sure. Patient 620, his name is Ryder Kine. He's a 67-year-old male, no known allergies. His diagnosis reason he's here is a stage 2 diabetic ulcer on his right heel. He complains of increased blood glucose. It looks like the reading for the past 5 days was increased, and it was in the 300s. He's been a diabetic for about 20 years. His pain is a 6 out of 10, but we did give him medication, and now it is a 1 out of 10. He's ANO times 4, medium fall risk. He has clear lung sounds, even effortless. All pulses are +2. Cap refill is less than 3 seconds. Normal rhythm. All 4 bowel sounds are active. Adequate food intake.
No wonder your last video was 25 minutes long.
Everything's in good condition. He's voiding. It's yellow. It's clear. And it looks like he's eating about half of his meals. A little bit over that. Okay. His last set of vitals was 98.4 temperature, 76 heart rate, 96% oxygen, and 128/70 blood pressure. It looks like he received simvastatin, gabapentin, insulin, and pH. We're going to be administering the insulin regular, and then earlier we did give him morphine to bring his pain down to a 1.
Thank you so much for giving me a report. Do you mind if I ask you a couple of
John,
questions
are you
regarding
sleeping?
insulin, and I want you to demonstrate giving insulin in the patient's room?
Sure. What questions do you have?
Why
You'll be in there
specifically
about
is
an
this client receiving this medication, and what action does this medication have on the body?
It's to control his hyperglycemia. Regular insulin lowers his blood glucose by stimulating the glucose uptake in his skeletal muscle and fat, and inhibits hepatic glucose production.
Okay. When should you question administering this medication?
If the blood glucose hasn't been checked or it's lower than 2,000 units a day, you want to monitor his blood pressure and respirations.
So those are the vitals that you want to monitor?
Yes.
Okay. And what about the physiological parameters? What should be monitored when a medication is being administered?
Definitely his level of consciousness and his skin color.
Okay. And what interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
You want to ask the nurse what type and dose for the insulin, make sure you're administering it, and where was it last injected.
And what interventions must be taught for taking the medication at home?
He needs to know the signs and symptoms of hypoglycemia, so tingling in his extremities, tachycardia, unsteady gait, if he's pale or feeling sick, and the signs and symptoms of hyperglycemia, which is when he's confused, he's flushed, and he has polyuria. Wants to monitor body weight and administer 15 to 30 minutes before a meal after he's done his AccuCheck.
All right. And what are the potential side effects or adverse reactions?
Hypoglycemia is the biggest one. Swelling, anaphylaxis is the most dangerous one we want to watch out for.
And how will you know that medication is effective?
If the blood glucose level is controlled without the appearance of any hypo or hyperglycemic episodes.
Okay, cool. Well, thank you so much for answering my questions.
No, thank you. Not a problem at all. It's important to know your patient and the medication you're administering to keep your patient safe. Hi, Mr. Kine. My name is Heather. How are you?
I'm doing all right. How about you?
Good. I'm going to be your student nurse today, and I'm going to be administering your regular insulin.
All right.
Okay?
Thank you.
How are you doing today?
I'm doing all right. Last time they gave it to me, it was in my left arm, so if you don't mind doing it in my right.
Sure.
Thank you.
Can you tell me your full name and date of birth?
Ryder Kine, 1148.
Start over.
No, I've been doing the lower right.
Alright. Do you have any questions for me before I give you this medication?
I don't think so.
Okay. Check the MAR. So, Kareen, you want to always check the MAR and make sure this is the right medication, right dose, right patient.
Okay.
That's what I've been doing.
Well, I think you should be rotating your sites,
Okay.
because, rotating your sites are very important.
Okay, make sure
so that
you
way
wipe the
don't
top.
get any, scar tissue buildup, and it doesn't affect the absorption of your medication, because this is a fast-acting insulin.
I'll draw back
you want it
first.
to work pretty much as fast as it can, so you can get what you need out of it.
Great, yeah, in that case, do whatever.
So you had it in your right flask.
Can you pause it?
Technique with
Alright,
your
and we're
hands
gonna be
out of the way.
administering 16 units,
And then
okay?
Okay.
over here
So you
you're
wanna draw
going
back to
to
16.
Okay.
outpatient that if you and observe the site, make sure there's no redness or itchiness or
Push down.
rash or anything like that, and then you're going to take the alcohol wipe and you're going to go from the inside of where you're
And
going to
make
give
sure,
it,
and then
work your way
recap,
out
you don't
and make
use
sure that it
your
dries
other
up.
finger, okay?
Mm-hmm.
And if you pinch you want to do it 2 inches away from the umbilicus. You pinch 2 inches and try to grab
it going?
this, and then
Yes.
there's a 90-degree angle.
Okay.
And what you're going to do is this.
Okay, so use one hand,
You're going to
cap
hold
it.
the syringe like a pencil, and you're going to go straight,
Alright.
stabilize it, and inject slowly, and make sure that you hold it there for at least 5
I'll wipe
minutes,
the
or
site.
5 seconds before the medication is, or after you inject the medication, make sure that it's all in.
One pinch.
And then you're going to
Right
take
angle.
and throw the needle away. You're gonna
And always
check,
disclose
make
the
sure that
instructions,
there's
okay?
no bleeding,
Mhm.
which usually there's
Thank
not
you.
unless
You
the
feel
person's
it.
on like
Alright, do you know the signs and symptoms? If you've experienced any hypoglycemia?
I do. Nausea, cold sweats, tingling.
Okay, alright, great.
Well, do great.
Wow, Heather, thank you so much for demonstrating a safe medication administration. I just have a couple more questions if you don't mind.
Sure.
Were there any pertinent pieces of information you reviewed before administering the client medication?
We wanna check the client's, blood glucose level to make sure it was safe to administer.
Did this information affect your decision to administer the medication?
Yes, the level was 290, so I needed to give 16 units.
And did this information affect how you administer the medication?
No, it did not. I would still administer it the same way based on the orders.
Wow, thank you so much for answering all of my questions. I really feel like I understand this so much better.
Again, not a problem at all. I'm always here if you have any questions or need anything. I'm actually going to take some time now and document the teaching I gave to the patient and any other things I did in his room. Do you want to observe me documenting as well?
Yeah, I would love to. Thank you.
Sure.